The industrial action embarked upon by resident doctors nationwide is already taking its toll on patients and hospital management. The National Association of Resident Doctors has insisted it would continue the ongoing nationwide strike until the federal government implements the terms of their agreement. These include the payment of salary arrears, the indemnity for their colleagues who died from COVID-19 pandemic, but the doctors have also described the current strike as being the last resort to get their demands met. For more on this, let's join our correspondent Joke at the Sawo reports from Abuja and Ikenna Amechi from Delta State.
Another round of strikes coming few months after a similar action. Hospitals admit they are now having to cut down on the number of patients they attend to as the resident doctors' strike enters its third day. Here at the National Hospital, our crew is not granted access to the wards, but a few patients are seen in and around the hospital. One of them is Mercy Sunday. She says her son's condition demands urgent attention.
I've not seen the doctor because the day I came, they told me that I should come another day, that I should collect the small card and go. So as I collect the small card, I did not come back the Wednesday, they say. So I see the condition, I have to be running. I'll be coming back.
The authorities here have devised means to keep work going, especially at the emergency ward, even though the absence of resident doctors greatly affects operations.
Yeah, good afternoon. Yes,
Tayo HAASTRUP is the hospital's spokesman. He calls for an immediate end to the strike in the interest of the patients.
It's our hope that this strike will be cut off as soon as possible so that there will be full complement of work. As I tell you, without the resident doctors in the hospital, there can be full complement of work because this supports their senior colleagues.
Among issues bothering the doctors are non-payment of salaries, non-recruitment of house officers, abolition of bench fees, non-payment of national minimum wage, and non-payment of insurance benefits to families of members who died in the line of duty. The striking doctors are themselves urging a quick end to the stalemate.
The strike has been effective, even though sadly, like we always say, we don't want strikes. We prefer to be working. But then again, when you've not paid doctors their wages for a couple of months, how do these doctors, if they fall ill, access care? So it's the same situation we are all in. Doctors too could be patients.
A last-minute effort by the federal government to nip the industrial action in the bud on Wednesday led to the signing of a memorandum of action. But the doctors at their National Executive Council meeting said that was not enough to halt the strike. Hospital authorities admit the resident doctors' strike is greatly affecting their operations, and the striking doctors will only appeal to the government to meet their demands for normalcy to return to the hospitals. Joke Adisa, TVC News, Abuja.
These are medical doctors at the Federal Medical Center, ASABA, but like their colleagues nationwide, they are not here to offer medical services. Meanwhile, the wards at the hospital are almost empty, with few patients at some wards and no doctors to attend to them. These patients is trying out self-help as a family member wheels him in a condition that wouldn't have been permitted. This woman just lost a loved one here. For the resident doctors, though they feel the pains of these patients, they still believe their action is justified, heaping the blame on the federal government.
They will say we should show understanding when you are patching, when you are giving your patient, when you are sub-treatment. That's not the best of it. We deserve better. So let our governments grant our request, come and sit with us and give us this instrument, and then our allowances be paid full 100%, not staggered payment. Our house officers for 3 months, for 4 months now, they've not paid them.
We're not really happy that the poor masses are feeling the pinch of what is happening right now. But then I keep telling people that it's even better a doctor stay out of work than work with on an empty stomach or work in an helpless situation, because that such a doctor, if he becomes harmful to the society.
It is Easter season, a time when the lessons from the sacrificial life of Jesus Christ should be highlighted. These doctors and their colleagues across the country say they have sacrificed enough, especially during the peak of the COVID-19 pandemic.
Every year we see all manner of pandemic. It was Ebola some years ago, and then Lassa. Today is COVID-19. Tomorrow could be COVID-21, COVID-32. We don't know the kind of ailments that are going to befall us. And doctors were the foot soldiers. We are the antibodies.
17 of our members have died. They have not paid any of this death in service insurance. All they want us to do is that we should just keep working. Our members will keep dying. Then who takes care of their wives and children at home? Who takes care of their family members?
Like the proverbial fight between two elephants, the grass being the health of the people, we keep suffering while doctors and the government continue to test their might in this recurring cycle. Ikenna Amechi, TVC News, ASABA.